All right, so we're calling this Sleepless in Seattle because you can't sleep without waking up with intense head pressure and migraine headaches. And what is the drug you're having to take to try to get a couple hours of sleep?
Sumatriptan.
Sumatriptan, okay. All right, so I'll just show you what we found. So here, this is a side view of an x-ray with her in the neutral position. And you can see how terrible her neck looks, and her atlas is pitched forward. And we know the jugular vein is sitting in front of there. We put a 5-pound weight around her neck. You can see the buckle there. And that weight, look how much better it brought her neck. So it's going to help retrain her neck. She's a graphic artist, so repetitive injury all day long, staring at the screen to make little details perfect, and I think that's what did her in. So here we can see that her atlas has gone up to the right, and over here we can see that the atlas is anterior on the left. And we chose to prioritize the anterior on the left more than the laterality on the right, and you'll see that in a minute. And actually, you know, let's be done with the x-rays and bring up, there's neutral. And right rotation. Okay, here we go. So we look at her from behind. From her symptoms, we're thinking jugular vein compression, buildup of pressure. She even felt that way. She describes it pretty well. So just looking at this from behind, you can see this big old bulgy venous, this vein. Look how bulgy that is. It's actually on both sides, but this one is giant. Makes me even think that there could be an AV fistula, where the high pressure artery is inflating the low pressure vein. And that does need to be ruled out. And then we look at her from the side, and you can see the jugular vein being dug into by the atlas. And I'm sorry, I just dissected this too quickly. Let me back up. So what we did, we know that she has to lie down for about 5 minutes before she gets triggered. So we had her lie down in the CT machine for a few minutes till she relaxed enough to trigger her. And you'll notice that when she relaxes, her jaw kind of opens up and it puts pressure on the jugular. It actually drives this styloid into the jugular vein. And there you can see it right in through there. And she does it on both sides, but the left side seems to be the worst. Now she had TMJ surgery, where the doctor did a great job of putting some fascia up in there, but somehow there seems to be some sort of adhesion or something from the surgery, or some propensity. So ultimately, she might have to have some of this tissue removed so she can have her jaw open without it compressing the jugular. But that's for another day. That's if we can't fix her with what we've already done today. All right, so you can see why we prioritize the rotation on the left. We adjusted the atlas from the anterior to move it away from the jugular vein, and that made her feel amazing, which was nice. It's also going to help the cerebrospinal fluid flow as it goes through there. We see these styloid processes. The styloid ligament that is calcified. If it's still not calcified up in here, so it's not exactly the styloid process which is here, that's all the way calcified down like we see in other people. So it is actually mobile, it's not adhered. So she can bring her head down theoretically without it absolutely being like tusks digging into the jugular. In her case, it's that jaw that is approximating, and of course we have this atlas that digs forward, so the jugular is between a rock and a hard place. The hyoid bone is sitting too far posterior, so one of the things we want to do is pull the hyoid back out, try to bring the styloids out, of course bring the curve back. But here's what's neat. Here is what is really neat. All right, so here we can see the venous congestion in the back there, and then we have her turn her head to the left. When she turns her head to the left and juts her jaw forward, look how much that opens up the jugular vein. And you can see that it collapses. This dilated vein up in there totally collapses on both sides when she opens up the left jugular. And here we can see how big it is when she's in the neutral. And then when she turns her head to the right, it pinches the jugular again, and we're almost out of contrast at this point, and it inflates that vein again. So we have proof there. And today we adjusted her atlas and made her feel better. We pull her jaw forward. So Sleepless in Seattle, because she can't lie down. So what did we do? After we adjusted her atlas, we had her lie on her back, and I held her jaw forward. And I just held her jaw forward, and we stayed there, and she never triggered. She felt perfectly normal and never went into any of the high pressure. So we've got a dental appliance coming for her that will hold her jaw forward about 3 millimeters, and she does that for about 6 weeks, and that should hopefully tighten up the ligaments in the up in there, probably the TMJ and whatever else is going on in there, and let's see if that's enough. Anything else? Any questions? Anything you want to add?
No, but thank you so much. You guys are beyond wonderful.
Sleepless in Seattle because she lives in Seattle, and obviously because she can't sleep. But she'll be able to sleep tonight.
Sleeping in Seattle.
You'll be sleeping in Seattle,
Yeah.
I promise. Well, we already confirmed that. All right.